Happy Hepatitis C Awareness Month. Today we will be joined by Dr. Justine Waldman, the President, Medical Director, and founder of REACH Medical, a nonprofit organization specializing in low threshold harm reduction medicine for people who face stigma and discrimination in healthcare. REACH, which stands for Respectful, Equitable Access to Compassionate Healthcare, has been operating since 2018 and aims to create a safe, stigma-free environment for people who use drugs. Dr. Waldman has been working with the Southern Tier AIDS program since December 2016, when she became the provider of the New York State Drug User Health Hub, a program meant to present syringe exchange members the opportunity to learn and be prescribed medication-assisted therapies. She continues this role today and is dedicated to the work of providing life-saving services to people who are less able to access them. One of the services REACH and staff help provide is hepatitis treatment. Hepatitis results in an estimated 1.1 million deaths worldwide, with an estimated 3 million new infections occurring every day. It is said that someone dies of a hepatitis-related illness every 30 seconds, more people each year than the mortality rate for malaria, tuberculosis, or HIV/AIDS. It is believed that over 3.5 million Americans, including more than 100,000 New Yorkers, have hepatitis C alone, and more than half are unaware of their infection. In honor of the lives saved and the lives lost from this preventable disease, please join us to review some common questions and misconceptions about the virus. What is hepatitis?
Anything that ends in itis in medical language is inflammation. So, and HEPA happens to be your liver. So it's basically liver inflammation. And so a hepatitis can be caused by viruses like hepatitis A, B, C, and there's actually like, I believe E and others, or it can just be a general inflammation of the liver is also a type of hepatitis.
How common is viral hepatitis?
There are 2.4 million people living at least with hepatitis C in the US, and that may be as high as 4.7 or as low as 2.5. So pretty common. Mm-hmm. And the symptoms of hepatitis tend to be nausea, vomiting, usually loose stools, and a severe hepatitis often causes the conjunctiva to turn, which is sort of the whites of your eyes, to turn yellow, and that's called icteric.
Oh, okay.
And you can also get a severe hepatitis where, because you're not clearing toxins from your system, where you get confused, like hepatic encephalopathy. So it can get super bad, and basically you can die from it, but not typical with acute hepatitis. Mostly not, doesn't usually cause death right away, but it can.
What is the difference between HIV, HBV, and HCV?
When a person gets a viral hepatitis, they may show no symptoms. That's pretty common with hepatitis B and C. Hepatitis A is the type that you get, it's fecal to oral, which means that kind of like someone rubs their butt and then somehow you touch their hand, and the hepatitis A can live on their hand for a month, and then you eat something, doesn't sound that pleasant. It typically happens in like closed living space, you know, where people don't have access to washing and cleaning and they're in closed spaces. And so the acute form of hepatitis, like you would see typically with hepatitis A or C, but sometimes C again goes unnoticed, is your eyes might turn yellow, the vomiting, the diarrhea, unable to keep anything down, might have some belly pain. And that's how acute hepatitis looks. Hepatitis A never becomes chronic, and once you've had it, you can never have it again, and you can be vaccinated. Mostly people only get vaccinated if they are using, if they are doing injections, or they travel to a country where it's endemic. Mm-hmm. And hepatitis B and C do have chronic forms. And so with those, you may see nothing for 10 to 20 years before you start to see something like liver failure, because it's been slowly kind of acting on the liver. And then it can suddenly cause liver failure or cirrhosis.
How do you get hepatitis C virus, also known as HCV?
Hepatitis B and C are both bloodborne. The bigger one that we see with people who inject drugs or people who snort drugs, a little bit less frequency, is from blood products. So reusing needles is one of the big ones. And I sometimes, well, maybe I'm like, I say to patients, like, I want you to be kind of OCD-ish and in your corner, wiping down your table, because it can live on table services for months. So you may have a clean needle, but put it on somebody's table or touch your, anything that touches that clean needle could have hepatitis C on it. And that's how people get it, because then they inject it into their bloodstream. So really easy to get hepatitis C.
How long do the different kinds of hepatitis live outside the body? How long does hepatitis survive in fluids versus other materials?
I read is hepatitis A is months, hepatitis B is 1 month, and now I've forgotten hepatitis. What did I write there? Hepatitis C is several weeks, right?
Mhm.
6 weeks, a month and a half. Is that you're worried about it sitting on any surface. It probably lasts a little longer in fluid, but it can last on a dry surface for up to 6 weeks. So I would take the 6 weeks as the big number. HIV doesn't last as long, which is why needles are so effective, like clean needles are so effective. So it can only last several hours on a surface, but it still does last, but clean needles are the best answer. And then just clean needles and clean surfaces are the best, and not using with somebody else near their space. You want to keep your needle away from somebody else's needle, is how to not get hep C.
How long can you have hepatitis C before it is noticed versus how long before it becomes a problem?
Often it isn't noticed before 10 to 20 years. So most folks who do have hepatitis C won't notice it. They won't have any real effects, but 20 years down the line, they could get liver failure from it.
Can you catch the different kinds of hepatitis more than once?
With hep A, you cannot, and with hep B, you cannot, but hepatitis C is interesting and has different strains.
Mhm.
And so you can catch it again. And hepatitis C is an interesting one because about 30% of folks will clear it on their own. So meaning you get hepatitis C, your body fights it like it might fight off a cold, and then you don't have hepatitis C anymore. But 70% of the time it becomes chronic and kind of slowly but surely attacking the liver.
How likely are side effects to treatment?
It's so funny. I've probably treated, let's say 50 to 100 patients, and really people don't have side effects anecdotally, like you just don't see it. But, on every drug, if you've ever opened up the pamphlet, it'll say you can get the following things. So you can get headache, nausea, irritability, some muscle cramping, but we don't see it. It's super easy to treat. Most of the insurances treat it with Epclusa, so it's one drug for all strains, and it's one tablet per day for 12 weeks. And then we wait 12 weeks to see if any of the hepatitis is hanging out, like, because sometimes you look like you're cured by your blood. There's no hepatitis hanging out almost right away, but a few could be hanging out. And then 12 weeks later, you just got to make sure that there's none in there. And then we know you have a cure.
Mhm.
It's like 4 in 100 patient years, which means for every patient you treat who inject drugs, 4 of them will get it again.
Gotcha.
Where can I get tested?
You can get tested at syringe exchanges or syringe service programs like STAP. You can get tested at REACH. You can get tested at almost any hospital as long as you have a provider who put in labs for you. One other thing to know, which I think always gets confusing, and you've probably seen this too, is there's 2 types of tests for hepatitis. One is a screening test, and that's an antibody test. And antibodies, once you've had something, an antibody will always be in your system. So if you've had hepatitis, either got treatment or your body cleared it itself, every time someone does a hepatitis screening test on you, it's going to come back positive. And it feels like lots of people like who are professionals in the business don't know that. So they call patients and say, oh, you have hepatitis, but it really just means you might have once had hepatitis. I'm not sure if you have it now. The other test, which is more specific, is an RNA test, which tells you how many copies of the virus you have in your bloodstream. So if you get a screening test that's positive, it may mean nothing at all. You need that RNA test to see if there are any copies of the virus around.
Mm-hmm.
When is Dr. Waldman available for medical appointments at STAP?
Available at STAP on Fridays from 1:30 to 3:30, and at REACH, I see patients on Mondays and Wednesdays right now, but pretty much I think all of our providers can treat Hep C. So we really love Hep C because it's the one thing you can really make better and can go away for folks. So I love that part.
Hi, Dr. Waldman. Love REACH in your work. Can you speak to the efficacy of harm reduction approaches and how treating active IV drug users leads to improved public health and voluntary admission into addiction treatment? Thank you so much to you and your incredible staff for improving the lives of our community members daily with compassion, confidence, and care. A grateful patient and person in long-term recovery.
Oh my gosh, nicest thing. So we see all patients, and we see that people who use drugs have many reasons for using drugs, and some people are very happy with it, don't have an issue with it, and don't see themselves as having an issue or needing treatment. Some people want treatment. It kind of goes all over the place. Some people have been unsuccessful in treatment that they wanted. And a lot of that I think has been because it's hard to find providers who are competent in sort of letting people take their own path where they want to go. But in general, there's huge reasons to treat people who are injecting drugs. And that is because if you treat, like if Ethan and I both share needles and Ethan has Hep C, then it's pretty likely that I'm going to get Hep C. But if Ethan doesn't have Hep C and he and I share a needle, then I'm not going to get Hep C. And so it really sort of disrupts the chain of the virus, and it decreases the number of cases we're going to see long term. So they used to only treat people when they could demonstrate that they weren't using drugs, which is pretty ridiculous. And now that has all been turned upside down, although I bet there are still some providers out there that go by that old premise. That's not true. That shouldn't be true. It's no longer the standard of care. You want to treat everybody. And then I usually just emphasize to folks that if you're continuing to use, please get clean needles, and please make sure that the area that you use in, like I said before, is, sanitized and it's your own.
What are some common misconceptions about the virus?
I just had, I think that some people are afraid to get tested. So I guess there's two. One is people who snort or inhale think that there's no risk with that. And unfortunately there is, because there's a mucous membrane here that can allow transmission, but it is lower risk than IV, but still great to get tested probably yearly. And again, easy to do. Like if you're going, depending on where you are, of course, but if you're going to STAP, just go ahead and say, can I get my, HIV and Hep C test? And then, but again, I understand that. I don't think you don't necessarily want to know, right? If bad stuff is happening and you're trying to get things together. So I get that. And the other misconception is that treatment a long time ago used to be with interferon, which was a really, really difficult drug to tolerate. And a lot of folks still think we're treating with that. And about 5 to 10 years ago, there were the newer drugs, which are called direct acting antivirals. They were really specific to the type of Hep C or the Hep C genotype or strain. That's no longer the case. It's really sort of like one drug fits all, except for the case with someone who was treated and didn't get a cure. Then they have to go up in level to a new drug called Vosevi.
Why are y'all so awesome?
I don't know. I don't think it would be, I don't know. There's so many daily issues in running an organization that it feels hard to say, but we try really hard, and we try to have a health equity organization where people feel comfortable going and feel like they're respected when they walk in the door or on the video.
Yeah, definitely. Okay, awesome. So that's all the questions that we got. I just wanted to thank you so much for taking the time out of your busy schedule to answer these questions from the patients. And I look forward to working with you and sending patients your way.
Thank you so much, Ethan. I appreciate it.
Yeah.